I am Dr. Shobna Bhatia. I am a gastroenterologist. I used to head the Department of Gastroenterology at KEM Hospital in Mumbai. Currently, I am in private practice at Criticare Asia Hospitals and also an honorary at Cooper Hospital in Mumbai. Today, I will be talking a little bit about ulcerative colitis. What is ulcerative colitis? So before I discuss ulcerative colitis, let me talk a little bit about what is the colon and what does it do. The colon is the last part of the gastrointestinal tract. The colon starts with the end of the small intestine and ends at the rectum and then the anus. Stool is formed in the colon. It is concentrated there and then comes down to the rectum and passed through the anus as stools. So the job of the colon is to store the stools, remove the water from it, and then help the individual to pass the stool successfully. So ulcerative colitis is a disease that affects only the colon in the GI tract. It does not affect the small intestine or the stomach or the food pipe. Now the colon has a lining which we call the mucosa. This lining is inflamed, which means that it is swollen because of some reason. This causes ulcerative colitis. So how does a person know that he or she has ulcerative colitis? What are the symptoms? The symptoms of ulcerative colitis are loose motions, which are accompanied by blood and mucus, which often looks like pus. Very often, an infection like amoebiasis or bacterial infection can also cause the same symptoms, but these symptoms will then respond to treatment which is given to you by your doctor. In patients with ulcerative colitis, these symptoms do not respond, or the patient keeps having recurring episodes of blood and mucus in stools along with diarrhea. Since the most commonly involved part of the colon in ulcerative colitis is the rectum, most of the symptoms also come from the rectum. Now, usually there is diarrhea, but when the rectum is very, very swollen, or that there is lot of inflammation in the rectum, there is lot of bleeding from there. The rectum is unable to hold the stool, which means that the person wants to go to the toilet very frequently, and each time passes very small quantity of blood or mucus and has to return back thinking that he has completed the stools. But then he has to go again after some time because the rectum is irritated. Sometimes the rectum is so swollen that it is difficult to pass the stools and the patient feels that he is constipated. This is accompanied by severe pain, and in medical terms, this is called as tenesmus. Instead of diarrhea and blood and mucus in stools, this patient has constipation, which worries him because along with that, there is a feeling of bloating and pain. Now, how does one diagnose ulcerative colitis? How does a patient know that he may be having ulcerative colitis and what should he do? So, if a patient gets repeated episodes of blood in stools along with diarrhea, it is time to show to a gastroenterologist. The gastroenterologist would do a stool examination and an endoscopy. Now, endoscopy through the rectum is called as colonoscopy. With the use of the colonoscope, the gastroenterologist can tell what is the extent of the colitis in the colon. So the patient may have only rectum involved, which is called as ulcerative proctitis, may have only half the colon involved, which is left-sided colitis, or the whole colon may be involved. So in 30% of patients who come for the first time, almost the whole colon is involved on day 1. This is called as pancolitis. In other cases like proctitis or left-sided colitis, this colitis may extend over time in some patients, but some patients it may remain as a localized form of colitis. During the colonoscopy, the gastroenterologist will also take multiple biopsies and decide whether there is only ulcerative colitis or there is something additional. And sometimes it may be possible that there is some disease which is different from ulcerative colitis. So this is the reason why a colonoscopy and a biopsy has to be done to diagnose ulcerative colitis. Now, once the disease is diagnosed, the doctor will talk to the patient and advise a few medications. These medications may be oral medications or maybe medications which are given as suppositories or enemas and are called as mesalamine. This group of medications is called as mesalamine. The next thing, if the doctor may advise, especially if the disease is severe. Now, what is severe disease? A severe disease is when the patient is passing lot of stools, it is not getting controlled, the patient is having anemia, fever, or multiple other symptoms. Then in that case, the doctor may advise additional medications like steroids and sometimes even further medications which modify the disease. Now, a patient will often ask, how long is this disease going to last? The unfortunate thing is, this is a lifelong disease. And even after it is controlled well or when it reaches remission, every year many patients will get 2 or 3 episodes of relapses. Patients often ask, why are there relapses? The answer is, most relapses are either because of stress, changes in diet, or some form of infection. Finally, what is the long-term risk to a patient? The long-term risk to a patient is that a few patients may develop a cancer of the colon. And therefore, the patient should continue going to the doctor even when he is absolutely fine, continue the medications, and then take care of his psychosocial aspect of his life so that he does not have much stress and does not have too many relapses. Thank you.